let's go ahead and hand it over to the Uganda team to give a talk.
So thank you. Good afternoon, good morning to you all. So my name is Edward Kakooza. I work with Walimu, and we are implementing the reimagining TB care in Uganda. I'll be making the presentation together with Ronald, who will be doing the demo for the eCHIS application, specifically for the TB module. Next slide. So that just gives us a small background on the TB cases, people that are missed in care. The numbers are going high or they increase, and then the different interruptions that we have had for COVID-19, and the need for the integrated and decentralized TB solutions that we came in ready to address with this. And the community-centered care, which really the eCHIS application is really coming in or came in to do, or to be able to help the VHTs in the communities do that kind of work. Next slide. So we are doing this study, and our main objective is really to evaluate the effectiveness, implementation, and cost of digital and AI-based strategies to improve TB community awareness, screening, testing, and linkage to TB and the comorbidities. Specifically, we are looking at developing a digital and AI-based strategy to support community health workers, which is the objective that I'm really going to present on. Later on, we'll do the evaluation of this to see if its effectiveness, and the adoption and implementation. We'll assess all that as after the completion of the study. Next slide. So the Ministry of Health had different systems. We focused on 3 of the systems which have been around for some time but have not been communicating to each other. And so through our through this study, we have been able to integrate these systems. So there is communication across these systems: the eCHIS system, the lab expert, and the ECBSS. So these are divided into 2. The community has the awareness, the screening, the household census, treatment, care, and then follow-up. And these are all done using the eCHIS, through the eCHIS application that is installed on the VHT's phones. So once they go into these communities, so what we have done through the RCT projects, we go to a community, we map the households, and the VHTs go into these households and register the households plus the members that were listed before, and they will do screening for all these members, screening of not only for TB but also for other comorbidities like HIV, malaria, and others. So that is all done through the mobile phone and the application, the eCHIS that they have. Once they sync the data is automatically sent to the eCBSS system through those green arrows that you see, and the lab system. So data is sent there, and when they collect the sputum from the communities, it is also transported through the hub systems in these communities to the gene expert site. So we also identify these gene expert sites. People are trained and they test these samples, and people receive the results. So once the results are out, the results are automatically sent to eCHIS and eCBSS. We have the eCHIS ID, which uniquely identifies the records that are there from eCHIS to lab expert and eCBSS. Then people receive results on their phones. The patient will receive a notification. The health worker at the facility will also receive a notification through SMS, and the VHT will also receive a notification via the eCHIS application, but also through or via SMS of the results. The notifications differ, or the messages that are sent differ from the VHT. They will tell them that the results of this person, this so-and-so person is ready, and maybe they turned out to be positive or negative. For the patient, it will be, your results are ready. Please go to the health facility to get more information. And then the health facility, again, they will inform them that the results are ready and this person is either negative or positive or something related to that. And when the result is invalid, again, the VHT is alerted through the eCHIS system to collect another sample of that. And we are using barcodes here. We introduced barcodes, one to help us track the samples, all the samples that are collected in the communities, but also to be able that we know that this sample belongs to this person. So we have the barcode is put on the sputum mag and the TB request form that these VHTs use in the communities before they are sent to the testing facilities. And at the gene expert site, these barcodes are one checked that they match. So we produce them in pairs, and also they are scanned so that it can be linked to that particular patient. Yeah, I think I'll leave that at that and then continue. So next slide, please. I think the demo will come in at the end. Please, next slide. So these are the TB result notifications and tasks that I was talking about. This is part of the notifications that come in through the eCHIS applications, and also the messages, SMS, that are received on the patient's phones, the VHT's phones, and the health workers' phones. Next slide. So this work is being implemented in 6 districts. We have so far done 5. We are in the 3rd district. As I speak now, I'm in Masaka, which is our last district. We started with Jinja, and then we went to Wachiso, went to Bushenyi, then Shema, and Bale. Now we are concluding with Masaka this month. So we'll be doing the training. So there are over 17 clusters, intervention sites across all these districts. And next slide. So we have so far trained 115 VHTs across the 5 districts and 17 supervisors that have been trained so far. And we are going to, that number will increase after we have completed training in Masaka. Next slide. So there's a lot of really impact that we have reached. There's expanded community reach because with our intervention, we go house to house. So like I said, the team maps a community and people go house to house, moving in there. And then there is improved data flow and integration. I talked about the integration between eCHIS, ECBSS, and Lab Expert, and data flow from all these systems. Like I said, we still have a loophole there because information that comes from ECBSS doesn't come back to eCHIS. So we need that to be covered. And I think if we get more funds, that is one thing that we are really looking at. And that is timely communication via the SMSs that I've talked about. Then the notifications that these VHTs receive for the invalid samples so that they can go back and really collect another sample. We have the strengthened linkage to care for the people that are found positive, the referrals, VHTs in the communities do referrals. So they are trained, we do training, and they know that they are supposed to do referrals. So they are provided with the referral forms to these for these patients to go to the communities. Next slide. So there's a lot that we are still doing as we speak. These are some of the next steps that we are looking at. There is supervision and mentorship. We are conducting routine visits and remote check-ins with VHTs and the TB focal persons. We have really established these feedback channels. We have established WhatsApp groups from Jinja, Mbale, Masaka, Bushenyi, Shema, and Wakiso. We have WhatsApp groups of all these VHTs for these different communities, and we check in with them. There is quality assurance that is really going on to assess the accuracy of the data that is being entered. And we have really done the SMS delivery audits, and we have assessed that the patients receive the SMSs in a timely manner, and also the VHTs, but also the health workers. So there is that good turnaround time that really patients receive the results on time and also be able to be acted on, especially those that are found to be positive. We have some simple dashboards, although we are really looking at a more sophisticated dashboard that shows individual data. Most of the dashboards that we have are a bit aggregate, that show aggregated data, but we are really looking at the individualized data because we have a lot of these people that we are really looking at and interested in. And we have been sharing most of these with the districts and our donors. At the meeting here, Michael has just stepped out, but I'm here with some colleagues from Walimu and also Michael, who is here to do some of the check-ins, and is from Stop TB Partnership, which are our main funders for this. So we have continued to work with the Ministry of Health, and we'll continue to work with them to see how this approach is institutionalized and incorporated into the national TB control guidelines. Next slide. So we have not worked alone to do this work. We have worked with the key stakeholders in Uganda. The Ministry of Health has really provided a lot of support. Ministry of Health, the Division of Health Information, the NTLP, MEDIC, who have been able to develop the TB module. The TB module was missing in the eCHIS application. When you look at the eCHIS application, it only had 2 questions about TB. But through this support, we were able to develop a full TB module, and MEDIC was able to do this for us. The Gene Lab have been also able to strengthen the lab expert system and the gene expert system, and HISP were also our partners that have also been able to help us with the eCHIS system to really be able to capture the data that is coming in from the eCHIS application and the lab expert. Dimaji mainly supported us with the AI chatbot. We are working with health workers, the TB focal persons, the VHTs, the in-charges, the local leaders. We engage communities. So all these people have been able to support us and are continuing to support us. This study wouldn't have been possible without support from CDC, COICA, and Stop TB Partnership. So we got funds from there to really be able to support or to implement this work. And the team at Walimu and our investigators, Dr. Achilis Katamba, Dr. Stavia, and Dr. Noah Chwanuka, have been able to provide really an exemplary leadership in this. Thank you very much. I'll leave the remaining time to Ronald to be able to do a demo for us. Thank you.
All right. Thank you, Edward. Ladies and gentlemen, I am going to do just a short demonstration so that we can have a peek into how the work was being done, how the work was being done, how we were collecting the data. So is it possible to stop sharing so that I can share? Okay, thank you. Yes, can you see my screen?
Looks good.
Yeah. Yes, so now we are in a household, in a VT called the Jock Gems, and we chose a Samo Christian household, and we are going to screen a Samo Christian for TB. So we just come here and then tap on TB screening. So we have this question asking, is a Samo Christian currently on treatment? Now, if she's on treatment, our workflow is going to end. But if she's not on treatment, then we can now, first of all, do a health education. Once you approach this person, you have to educate them on what you're trying to do. Answering what is TB, what it affects, and you have to tell them who are the people who are at high risk of getting TB. children less than 5, adults older than 65. If you're in close contact with people who have TB, HIV-infected persons, malnourished, so they have to go through this whole list and then explain to the person that they are screening. Yeah. And then after that, we now have a health and status check. So this question, select any risk factors that some Christian may have. Someone who has diabetes, the miner works in the mine, been in prison last month, they smoker, they maybe take drugs. All these are factors that just increase the risk of someone getting TB. So you have to ask, and maybe they can say, okay, I was in prison last month. And then we get to the page for signs and symptoms. So in this page, we have about 6 signs and symptoms with images so that it can be better understood by the person who's screening. When they're having cough for 2 or more weeks, excessive night sweats, unexplained weight loss, loss of appetite, there's chest pain, and then finally, poor weight gain among children. So the VHT will explain this to the person. And after explaining those signs and symptoms, we now come to this page and then ask them if they're actually experiencing these signs and symptoms. But for the case of this demo, I am going to say yes to most of them so that this person can be suspected to have TB. See that. But ideally in the field, they will follow up on the answers. Ask about cough, fever, weight loss, if someone lost more than 3 kilograms suddenly, excessive night sweats for 3 weeks or more, loss of appetite, they had chest pain, or they had contact with a person with TB. Now you see at the end of the page, we already have a note. Asamo Christian has suspected TB signs. Follow the instructions in the next page to collect the sputum. So because we said yes to most of these, the algorithm finally suspected having TB. But maybe if I'd said no to most of them, there's a whole mix of if you have A, B, C, you have D, C, F to suspect someone to have TB. Yeah, which we have at the back end. And now, has Asamo Christine consented to give her sputum sample? So if the person says no, what we do, we send a task to the HA, that's a health assistant, at the facility. The HA will get a task with the name of the person, the village, and they're able to follow up and then collect the sputum sample themselves. See that? But if they say yes, and now if they have a phone number already recorded in eCHIS, we shall say this is our registered number. Would you like to go ahead and with that number? Or if they lost the number, then just say no, and then you enter a phone number that you would like to receive the SMS on once the results are back. And then now we come to the barcode scanner. But since we are doing a demo on a laptop, we cannot see a button. Ideally, we would have a blue button here, say that tap to launch the barcode scanner. Once you tap this, it would open the camera, and then the VHC would point it to the sputum cup or the sputum mug, and it would automatically read the barcode. But for this, we're going to just enter. Let's say it's going to enter code. Let's say 2023 03 0817. Yes. So now this is like the structure of the code we have on the cup. So while we're doing a barcode scanner, it's just them entering this. There's a very high likelihood for mistakes, and scanning it was the most accurate. So then, has this person produced? Okay, we have this note. Give us some instructions on how to collect the sputum. Give the sputum collection bottle and ask her to put in enough sample, then tightly close. So they brief the person who is being screened how to create the sputum and put in the cup. So if they haven't, let's say they haven't been able to produce the sputum, we instruct you to leave the bottle with the client, and then you instruct them to put the sputum in the morning. See that? And once they put the sputum in the morning, you come back and collect it. We have a task for you to collect. But in case they're not around, we can still send another task for you to collect. And then, okay, now this marks the end. Now this Asamo Christine has already, she has been screened. Now if her results were to be sent to the facility, she would now receive the SMS you saw, and then also the VHT would now receive a task like this, that her results are back and she's TB positive. Refer her to the facility for further examination. Then from there, now we have tasks that will monitor her from when she's back from the facility to 7 months down the line, ensuring that she takes the medication. So for time, I beg to stop there. Yeah, over to you, Anthony.
Thanks, Ronald. Thanks, Edward. I'm jumping into Anthony. Anthony, did you have anything to add, or should we press ahead with questions? Okay. Yeah, really great to see how that whole workflow works and the development of it. Does anyone have any questions before we move on to the next topic? I didn't see any in chat. If you do have questions, feel free to follow up in the forum. We'd love for folks to engage. The Roundup Call is a great place for partners looking to develop their own program to meet up with other partners who already have developed similar programs.